Hello there, my name is Beth. I am doing a video on ALS. Um, Today is February 14th of 2024, and the reason I decided to do a video is because when I got diagnosed last year, two of the videos really helped me to see, okay, this is something like I need to look, and I'm going to tell my story in a minute, but I just want y'all to know that I even wrote down their names. I know that this gentleman has already passed away. His name is Kevin O'Donnell, and he did several videos as his ALS progressed, and just seeing his bicep keep twitching, which in ALS is called fasciculation. Seeing that, just, I don't know, something about it made me keep paying attention. And then the guy that's on the channel he has, maybe it's his wife's channel, it's called Schoolroom Help. That really helped me. My symptoms are the closest to his. They almost totally mirror it. So my goal in this video is to tell y'all what happened to me, like how I figured out that it was ALS or something serious. And my goal is that just like people being on YouTube helps me to get diagnosed faster, I want to be able to help other people, because I don't want people to go through like an unnecessary hand surgery or back surgery. And fortunately, that did not happen to me, even though it was discussed. But I did enough internet searching and looking But anyway, so let me start from the beginning. So right now, my voice is different. Like just now, me trying to say is different. I kind of tripped over my words. And I normally talk really fast. And but my first symptom that I'm aware of, my husband says when I read the scriptures to him in the morning that even before 2023, he sometimes he'd hear me say something a certain way and he just thought, oh, it's old age. And so I just turned 58. So how I see it is that at the beginning of my 57th year is when I think that my symptoms started in earnest. So I'm going to go backwards. So the first symptom that I know of was not only me starting to, like when I would read him the scriptures, occasionally I would say a word, and it's kind of like I would shorten the word, like if the word was misunderstood, I didn't quite finish the end of the word, or I was, just not enunciating right. But it was just a couple of times a month or something. Nothing that I thought of. The other thing that started happening is that when I would be standing in the closet and I would, so let's say that I'm standing there with a load of clean clothes and I'm pulling down coat hangers and hanging stuff up. So when I would go to hang up my pants for work, and you know how your coat hanger can have like the two clips on each side? Well, I'd go to do that, and I said to myself, something's wrong with these hangers. Like, I can't even get this one open. And I had bought those hangers like 4 years before or something, and this went on for months because you don't know something's wrong. You give it other explanations because you don't know what it is. And so I just kept having a harder and a harder time with my trying to open that thing up and slide it in. Well, so sometime around March or April, my sister said to me, Beth, look at your hand. And so let me see if I can show it to y'all. Can you see the difference? See how that is caved in? This is my normal left. I know it looks right, but because the camera reverses it, this is actually my left hand. This is my normal hand and what it looks like. And now this, oh yeah, you can see how it's caved in right there. And then if I was able to show you, if I did my hands like this on the other way, you would see how slim this hand is now. I hadn't tried that before. You can see it a little bit how this hand is slimmer. See how there's like not meat there, and then you look at this hand and you can see the meat. So the muscle's gone right here. So my sister saw this indentation. She's like, look at your hand. So when I saw that, I was like, that to me was not explainable in any other way. Like, I thought the coat hanger was messed up, and I thought it was old age that I would sometimes mess my words up. But this was like, okay, no, this is not normal. And so I called the doctor and couldn't get in until I think June 5th of 2023. So when I saw him, he felt like my face looked kind of weird, and he wondered if I'd had a mini stroke, and he felt like my voice didn't quite sound right, and he didn't like this. He said, he goes, I don't know what it is. It could be a bunch of different things, but something's wrong with you neurologically. And so he sent me to have a brain MRI. Sorry, hang on. And then that came back clean with nothing wrong. And so when that did, he sent me to a neurologist. But also in the interim, I had already referred myself to a hand doctor because I thought it was just a hand problem. And I saw the hand doctor, and they put 2 shots in me right here. And I had been, the whole time I had been Googling, muscle loss in the hand, just different phrases like that. And it always kept coming up with, these are 8 different things that you could have. And I'd go through and research them. Some of them you can throw it out immediately, it's not you. But I went back to MS, ALS, or myasthenia gravis. So it didn't take very long for me to see, okay, it's not myasthenia gravis. And so I would some days feel like, maybe I have MS. And then some days be like, oh my gosh, maybe I have ALS. But your brain says no. Like, that's not going to happen to you. Like, that's something big. That's always something that happens to, like, the other person. Like, my whole life, I always feel like I've been fortunate and blessed. It's always, somebody else or, I feel bad for somebody else, but, you just don't think that it's something big like that. You think there's going to be an explanation. And anyway, back on target. So I saw the hand doctor. They put 2 steroid shots here. Oh, because I forgot to tell you another big symptom I was having. I would be at work, and I was a play therapist, and let's say I'm getting down to the floor to sit with a child and play. And all of a sudden, my finger would slam down like that, or this one would slam. If I was reaching back for something, 1 or 2 of them would slam down. It's like it slammed down like a cramp, but it was really strong and fast, and it hurt. And I had never experienced it before. And that kept happening consistently. And so I was like, okay, that's not normal. So I had already referred myself to a hand specialist. They did the steroid shots, and I said to the doctor, because he already warned me you might have to have hand surgery, and he wrote down carpal tunnel. Well, in my mind, I thought, I had carpal tunnel years ago when I worked at a job where I had to type a lot, and I knew what that felt like, and this wasn't that. But you don't really know. Like, you're just trying to find out. You're not a doctor, kind of a thing. And so I said to him, is it possible this is ALS? And he paused and he said, we won't know until after you go see the neurologist and have that EMG, because this was in the interim, and he knew that was going to happen. So I wasn't supposed to go see him for a couple of months till I had been worked up by the neurologist. Well, when I went to see the local neurologist, who does not specialize in ALS, but he's a good neurologist, I went to see him, and he did the EMG test, which is where they stick the needles in you into your muscles. And he didn't feel like it was really indicative. And I did learn later when I looked at my medical records that a couple of my muscles sparked, but it wasn't enough, to say that I had ALS. And so he said, I think this could be explained that you just got something wrong with the disc. And he goes, we need to do an upper spine MRI. So I got that set up real quick. I mean, my background is as a social worker. I've worked in medical social work. I understand the system. And I was seeing these doctors back to back once I got it going, trying to find out what's going on. So I go have that MRI the next week. And then a few days later, I'm back in his office because I'm I want to know, I think I called and got, if there was a canceled appointment or something. So this time, back in his office, I could tell a difference in the room. And he told me the MRI scan is not remarkable. You have a little bit of normal, arthritis that people would get due to your age, but it's not remarkable. So basically it was a clean MRI, so it wasn't the spine thing. So he said, we need to see you back in August. This is August of 23 that he's talking about. He said, we need to see you back in August, and I'm going to repeat the EMG. And I said, do you feel like this is more than 50% chance that I have ALS? And he's like, I can't say that. I just don't know. I don't have enough data yet. Which is legit. But there was a different feeling in the room. And I just said to myself, sorry, I got a drink. I said to myself, I need to go, I gotta, it just didn't sit well with me to wait. I'm impatient and I did not want to wait. And so at home, I started looking up ALS stuff and found ALS of Georgia. And I found Robin Rakoff, who's their person that is the support group leader and stuff like that. So I called her, and my husband, as soon as I told him that, he's call, because we also looked it up and saw that the neurologist did not specialize in ALS, and that is a tip I will tell you, is I think if you have any legitimate thoughts that you may have it, you need to get to someone who knows how to diagnose whether it is or it isn't. So because I wanted to go ahead and maybe be seen by somebody who specialized in it, that's why I started looking at ALS stuff, and then found Robin. I called her. I described my symptoms, and she told me the options for which medical facilities I could go to in Georgia and in North Florida. And then I chose the closest one was 2.5 hours away, but it was an ALS clinic. So I go there. So wait a minute, I got sidetracked, so I looked down at my phone. So when I described it to her, she said, she told me the options, but based on what she was saying and what I understood, I'm I'm going to go see Dr. Rivner in Macon. So she said, if it's not that, he'll know what it is. That gave me a bunch of comfort, because I was because I didn't know if it was that, but I wanted to know, what is it? So that appointment was not till mid-August of 2023. So my husband and I drive up there, and even on the way up there, let me back up. Whenever I called and talked to his team lead person, that woman told me he will know if it is or it isn't, and he doesn't mess around with a life-altering disease like that. He's gonna know. So I went there with faith that he would know. But on the way up there, I felt so dumb. Because some of the symptoms had kind of gone away. And that's one of the things that I eventually found out, is that you can have symptoms happen and then they can stop for a while and then start back up. And like some things can get stronger and some things can lessen. Then, I mean, it just kind of goes around. Like, saying goes around doesn't help. They come and go, and they can speed up or slow down and that kind of thing. And a couple of the symptoms I wasn't even hardly having anymore, and so I felt dumb driving up there to go see him, thinking this is in my head, I've exaggerated this. And later, my husband, when he found out that I had been thinking that, he said that he would have told me, even if I would have said that out loud, he would have told me, no, we're going. So we go up there, and he does a verbal interview, and then he examines me, and my husband's in the room the whole time. And after 2 hours and 10 minutes with him, he goes, okay, I think you have ALS. And like, I sat up on the table, and I'm like, what? I thought you were going to tell me this was in my head. Like, I was just, not expecting it, surprised. And my husband, his face went pink, like pinkish red, and like he didn't speak. He just looked at him, and he was stunned. And a side thing that I was dealing with in my head about whether I really had this diagnosis is that my little brother has this same thing on his left hand, and he has had that for like 7 or 8 years, but it's never gone anywhere. He has no other symptoms. He just has that. And I had told the other neurologist and Dr. Rivner about that. And my older brother has he has hand tremors. And both neurologists told me that means nothing. Only 10% is familial. It does not matter that your brothers have that. You have this. And I still left there feeling unsure if I really had it, because I couldn't get it out of my head that my little brother has this big symptom but nothing else. Well, what took me out of denial was, as the weeks passed, like when I saw him, one of the things he had me do was drink water, and he listened to my throat, to my swallow. And he told me, like when he told me what his findings were, first of all, the EMG was positive. Like my muscles were bouncing and all, whatever it does that it registers on that screen. But also my swallow, and he said he could hear it in my voice. I'm like, what can you hear in my voice? I can't hear it. I know what I sound like. And he's like, but he's like, I can hear it in your voice. And also a neuropsychologist who used to rent office space from me told me that she could hear my voice. And this was before I got diagnosed, so I just was kind of incredulous, like, you're kidding. So a week or two after we got back from seeing that doctor, I started being able to hear it slightly in my voice. And I was like, uh-oh. Another thing that started happening is I started being able to feel the muscle twitches in me. So for me, here we are, it's February of 2024. So I've probably had this disease for about 14 or 15 months. And, my hand keeps getting like thinner, smaller, but overall it's weaker. My arm is weaker. Like, I don't trust carrying a baby in my arms. It's kind of getting too iffy to do that. So not only is my speech weird, and it's a little bit better right now because I started taking one of the ALS medicines, but that's a whole nother video. So anyway, so my arm, so I have muscle twitches all over here, so that has started. Now, as time has progressed, so when you have ALS, you go see the doctor about every 3rd month. And everybody checks you out. The OT, the PT, the speech therapist, respiratory nurse, the voc rehab person from ALS of Georgia comes in, and the doctor. So you see those people back to back, so you're there like 5 hours. people are very qualified, very good, very loving, funny. So, this whole time I never checked the volume. Oh, I hope this will be loud enough. So, what was I saying? So, as I've progressed, now the muscle twitches, I can now feel them here and here in my left arm. And sometimes I can feel them on my shoulders. And like one night I was laying there and all of a sudden I could just feel them right here, like going around my cheek. So it's happening, and I think I'm going to put this video up, and just really grateful to the people who have posted their videos, because it helps people be able to see it. And people it can start in different parts of your body. I can still walk around. I have no foot drop. I drive. But emotionally it's been harder on me. And like I had some of what's called pseudobulbar effect, where I laugh inappropriately and cry a lot. So, but you really can't look at me and know that I have ALS unless you know what you're looking for. And like now, even my friends are like, okay, now we can hear it in your voice. But like I say, my voice is a little bit better right now because of me taking this medicine called Nudexa. But I think that's going to be it for this video, and I hope it will help people. And I might do another video where I talk about, what it's like making decisions about whether to take medicine or not, and maybe the emotional stuff. I'm not sure. All right. Good luck, y'all. Bye.